Hey, it's Tom and happy Tuesday. During this time of coronavirus, we have a couple of things we want to reinforce to you. Number one, as an agency, we are open for business. It is our responsibility to care for Georgia's most vulnerable children and families in spite of whatever public health emergency may be going on. And it's also our responsibility to make sure that those who are impacted economically by this time are able to get the benefits that they need to keep going, such as food stamps and Medicaid. Just want you to know, though, that during this time we are doing everything we can to keep our staff healthy, to keep our providers healthy, to keep certainly our foster parents and children in our care healthy, and to keep the public healthy. So we're encouraging folks to use online services, to use our call center in terms of the social work we're doing, going out into the community. We are encouraging our case managers and our foster parents to use Skype, FaceTime, telephone for contacts and visitation. We have sent out guidance for our healthcare providers to use telehealth, telemedicine whenever possible, for our foster parents, for our case managers to practice social distancing whenever possible. And so we really want to make sure that we continue to do this work, but to do it well, we have to all be healthy and we have to all be safe. So let's do all that we can during the coming weeks to keep that social distance, to use telephones and to telework whenever possible, and to use Skype whenever possible for all the work we need to do, while keeping up with the work that must continue. I know that we have also, of course, we continue to just encourage people to if they feel sick, to stay at home, don't come to work, telework if you're able to do so. Continue, of course, to practice the hand washing that we've all become so accustomed to in the last few weeks. Governor Kemp, I know, has been very transparent about the state of the COVID disease and what's going on. He's giving press conferences, I think, on a daily basis. The Department of Public Health also has a COVID website that you can go to find out not only what you can do to prevent the spread of the disease and to slow it, but also to where we are in terms of the number of cases. And I know, of course, that I think really all the schools are out right now. I know that some of our staff are having issues with child care. But again, we are essential we're essential employees and an essential agency during this difficult time, and we have to keep doing our work. So let us do the best we can to keep plugging along and to keep serving the people of Georgia despite what's going on. And as I said, the best way we can do that is for each of us to take every precaution necessary to stay healthy during this time. So, of course, as I said, the work does go on, and I want to take just a moment to talk a little bit today about National Social Work Month. I got to thinking the other day, we had some visitor from another country come and wanted to learn about child welfare in the United States and in Georgia. And it gave me an opportunity to think about the fact that the social work profession itself is only maybe 150 years old. It was really in the late 1800s that social work became professionalized, that we developed such terms as casework and case management. And even going back to if you go back to like the late 1700s, the idea of society and of social workers who were going out and either on behalf of government or on behalf of a nonprofit or a civic organization, the idea of folks going out and managing social problems was really not that heard of. It was really thanks to the social reformers of the early industrial age, people like Charles Dickens, that we began to develop this social conscience that we as a society, and it of course started off with individuals and nonprofits, that we as a society have the responsibility to care for the orphan, the poor, and of course that goes way back, of course, to the Bible itself. But we really, I think, can trace the roots of our current social work to that period in the 1830s, 1840s, 1850s, when we began to really professionalize the work of helping other people. And so if you're a social worker, or if you simply work in the social work field, doing the case management, doing the care for others, that is very much a professional job. I want to thank you for all that you do. I want to remind you that you're part of a long history. This history, think about it, has survived through other epidemics, through wars. We continue to get better at what we do. And so even during this time, we'll just keep plugging along and doing great work. Also want to remind folks that the State of Hope applications, we're still getting those. Let's make sure that we apply online before April 10th. And also want to remind folks that the census remains a key priority for our state. I think a lot of folks are getting reminders at their homes, for example, that they can go online and apply and sign up for the census, or give their information to the census. So if you're a foster parent, or if you're a group home, or if you're one of our staff, or whoever you are, let's make sure that we're taking the steps to respond to the census and be counted. Because the more of us that are counted during this process, the more likely we are to get the federal funds that we need to care for the vulnerable families of the state, the more representation we have in Congress, and frankly, simply a matter of exercising our part in a democratic society. Thank you for all you're doing, especially in this difficult time. I think Franklin Roosevelt said of World War II, way back when in 41, that we have nothing to fear but fear itself. And we certainly don't want to diminish the impact of coronavirus on our lives. It is a health risk. It is a public health emergency. But don't simply react to it. Let's act in a way that we can all remain healthy, that we're using common sense, that we're using that social distancing, that we're reducing the impact of this virus on our own families, on our own colleagues, on our own neighbors, and especially on those who are vulnerable due to immunocompromised systems or their age. So don't fear. Just be precautious, take precautions, and use your common sense, and stay home whenever you can. And thank you for all you're doing. We'll see you next week.